just hear me out, and I'll try to sound as less technical as possible. Just imagine that in a tank, 100 ml of fluid is coming inside and 80 ml of fluid is going out. That 20 ml of fluid, which is there in the tank, is exerting some sort of pressure in the walls. By any reason, if the outlet gets blocked, or if the flow of water inside the tank increases, that creates pressure. This is exactly what happens in terms of glaucoma. Because of some or the other reason, and mind it, this pressure or this fluid that I am talking about is not the tears that you see. Glaucoma is totally related to the inside mechanism of the eye. So I've talked about the symptoms. I've talked about regular checkups that you have to get it done after 50 years. Whenever you go to your eye doctor, you just ask them one question. Sir or ma'am, is my pressure normal? The normal pressure is different from for patient to patient, but mostly the normal intraocular pressure should be less than 20 to 22. So if your pressure is somewhere around 18, 19, it is almost indicative of the fact that you are in a lesser risk zone. Of course, there are patients in which we have something which happens at normal tension also, but that you need not worry. So once what you can do at your level is you go to the eye doctor, you tell your eye doctor, sir, I want to get my glaucoma tested. So he will check your eye pressure. Now, unfortunately, as a doctor, these nerves that I keep talking about, these optic nerves, I can see them only in 2D. I cannot see this in 3D. Only a machine can pick up this particular nerve in a 3D view. So your glaucoma doctor will ask you to do 2 or 3 tests. On the basis of those tests, you will come to know if you have glaucoma or not. If you don't have glaucoma, the battle is already won. If you get detected as glaucoma, most of the times your eye doctor starts one eye drop as a medication. Now, what do these eye drops do? They reduce the pressure of your eye. So, if somebody of you goes to an eye specialist and the pressure that they come to know is something like 26 or 27, so the doctor will, after seeing your tests, will give you an eye drop. That sir or ma'am, you're supposed to put the eye drop every night before sleeping, or you are supposed to put it twice in a day. So then he will start the medication, and then after 15 days, he will call you back and he will check your pressure again. If your pressure has come down less than 20, the battle is already won. If the pressure is not yet controlled, he might increase the dose of medication. So this is a very simplified approach to glaucoma. Now, usually my patients have 3 misconceptions. Misconception number 1, sir, if we start the medications of glaucoma once, do the medications of glaucoma continue throughout life? This is absolutely a misconception. We can always take an attempt to stop the medications, but mind it, please do not do it yourself. You ask your doctor to do it. What I do for my patients is I keep them on glaucoma medications for 3-4 months. I call them again. I do a trial for 15 days in which I see how much pressure is going back to the normal limits, and then I decide. This is known as drug titration. Second thing which I've seen a lot of my patients do is we tend to take a lot of second opinions. Glaucoma is a disease of before and after. So what we do in glaucoma, you compare the tests of 2025, you compare the test of 2026, you compare the test of 2027. and you see how much nerve damage is happening. It's something like a before and after. So, especially in cases of glaucoma, I urge my patients to fix one doctor if possible. It's always great to take second opinions, but the entire medical history should be, you should keep on going with one doctor. Third myth, a lot of times some glaucoma eye drops have some side effects. They include itching, watering, and redness. 90% of the patients are comfortable with the drugs that we start. 10% patients usually are not very compliant or comfortable with the medications. In this case, you go back to the same doctor. You request them that, sir, the glaucoma medications that you started, I feel that they don't suit me. You don't stop the medication. So, what your glaucoma specialist will do, he will change the therapy. He will shift you to another molecule. So, one of the main concerns of my patients is that, sir, why do you have to keep putting drops for such a long time? It is a disease which is similar to blood pressure and diabetes. You have to keep on taking the medications. The most important question that a lot of my patients ask me that, sir, we have been putting medications since last 5 years, but I don't have any benefit. To these patients, I explain only one thing. There are two types of benefits. One, or there are two types of profits in the world. One in which there is profit, and second in which the loss stops. Stopping of loss is also a very big profit for the body. So, in case of glaucoma, even if you keep taking regular medications, the vision which is lost will not come back. But if you keep taking the medications, the reduction of the vision will stop. So, please, please, please try to understand this fact that if you don't put these medications, there is a probability in 6 months, 1 year, 2 years, 3 years, 6 years, 10 years, your vision will totally go away. Once the glaucoma damage has occurred, there is no technology on the earth which can reverse that damage. A lot of my patients also ask me, sir, is any glaucoma surgery possible? Yes, glaucoma surgeries have wonderful results. We make a small pathway in the eye for the pressure to reduce. But surgical aggressiveness is not the first line of action. In case of glaucoma, the first and the easiest way is to start eye drops. If the patient is tolerating the eye drops very comfortably, then you can definitely avoid going for a surgery. Glaucoma, in some cases, are also connected to cataract, but cataract and glaucoma are completely different. If you are addressing cataract, your vision will improve. If you are addressing glaucoma, that's a very different issue altogether. A lot of patients tell me that if we operate cataract, will my glaucoma go away? So these things are very case to case oriented. Both of them are not mathematically related. In case of human body, 1 plus 1 can also be 11. In case of human body, 1 plus 1 can also be 2. Yes, it is absolutely fine to do a cataract surgery with glaucoma. The only thing is your doctor has to explain it to you that even after cataract surgery, your glaucoma medications will be on. And one most important thing that I really observe in my clinical practice, that patients start getting tired. That, sir, we have been putting medication since 5 years, since 10. I have a 75-year-old respect